Hi, my name is Claire Urchell, and I'm a Level 1 Master of Athletic Training student at North Central College. In this podcast episode, we will be talking about sleep and cognitive function, as well as its effects on sports-related concussions. With me today, I have Dr. Kaitlin Riegler, currently a postdoctoral fellow in neuropsychology at Princeton Neuropsychology and the Sports Concussion Center of New Jersey. Dr. Riegler, would you like to introduce yourself a little bit more and talk about your background?
Yeah, sure. So as you mentioned, my current position is postdoctoral fellow in neuropsychology. Prior to this, I got my PhD in clinical psychology from Penn State University with a specialization in neuropsychology. And their part of the research lab that I was in was related to sports-related concussion, as well as like the concussion management program at Penn State. And last year, I completed my clinical internship in psychology at the VA in Connecticut, the healthcare system there, before doing my postdoctoral fellowship. My history with concussion research goes back a little bit further, even than grad school. From 2014 to 2017, I was working at Princeton University. It was the first year that they had the CARE study. Actually, they were one of the initial sites. So the big NCAA DoD CARE consortium study was just starting at the time. So I was the project manager for that at Princeton University and overseeing a couple other concussion research projects that the Ivy League offices had going on at the time. So kind of been involved since I'd say 2014 in terms of like the concussion specific research.
Yeah, that's really cool. Would you be able to talk a little bit more about that like care project that you mentioned?
Yeah. So it's kind of morphed into something different over the years as they've had more sites. When I was first starting, really the idea was to have the largest kind of prospective, like epidemiological study on concussion. I kind of thought of it like, I don't know, the way I would explain it at the time was like the Framingham Heart Study, but for concussion, like really to establish prospectively in this group of people that we know is at higher risk of sustaining a concussion. So, we're obviously not going to go around causing concussions, but if we pick a population that we know is more prone to get a concussion, we could kind of assess them beforehand. So kind of get the baseline assessment and then at certain time points afterwards. So it's kind of like rooted in that theory of kind of like the sports as a laboratory model, right? The baseline testing with the follow-up evaluations after injury. So it was at, all of the military academies, as well as, it started at a certain number of universities, and then it's kind of grown over the years. I think now there's like different regional hubs and kind of additional components like neuroimaging, blood biomarkers. But, what I was involved in was mostly baseline neuropsychological testing, baseline sideline testing of the athletes, and then any follow-up. And it was at very specific time points afterwards,
Yeah. Yeah. So I know like in our emails we've kind of talked about that like the sleep and um that kind of stuff was like your wheelhouse. What brought you to study sleep and the impact it has on mental health and cognitive functioning?
Yeah, so when you're getting your PhD in clinical psychology, there's like a couple of different, I think, like buckets of work that you're doing basically. So you're doing your research at the same time that you're in classes, but you're also simultaneously doing clinical work. So what that means is I was in the Penn State Psychological Services Clinic, which is a community-based mental health clinic, where we get like referrals for a variety of questions from people in the community, people at the university. So it might have been that they had a concussion. It might have been that they were older and were concerned about memory problems. It might have been um, that they had a history of ADHD. And so I was doing all these things simultaneously, testing our student athletes, doing the concussion testing, but then also testing people in the clinic. And no matter who I asked, we get a thorough clinical kind of background. And everybody, nearly without fail, maybe it was more rare to have somebody say they had good sleep than to say that they had a problem with sleep.
Mhm.
And so that's part of our recommendations then when we're doing like a clinical evaluation would be, improve your sleep hygiene or, get checked out if it might be a sleep disorder. So, recommending a sleep study. So we do these evaluations. I would put this in the recommendations. I was also noticing, right, all the athletes I was testing were also having poor sleep. So if we were seeing them for concussions, falling into the same pattern. So I started to get interested in it. And then as neuropsychologists, we're trained as clinical psychologists first, which means in addition to doing the evaluations, we also do interventions. So it'd be piling up this list of, neuropsychological evaluations that I was doing, and I was referring people for, sleep interventions, improve their sleep hygiene, but I had no good place to tell them to go. Penn State is in the middle of the state of Pennsylvania. So it's kind of, we serviced people right for 3 hours, like around State College. So it was just a little bit more limited in terms of services. So that got me interested in then doing a sleep intervention. So I was doing that clinically, and then I started to kind of do research as well. That was like kind of complementing the clinical work that I was doing.
Mm-hmm. So I know you talked about the athletic portion of it, but kind of bringing it back to like an everyday life. Like, how does sleep impact a person's day-to-day cognitive functioning and mental health?
In basically like every way possible, I would do like some psychoeducation groups, at my previous clinical placements. And, I would tell people, imagine, I told you that I had like a pill, right? Like a medication, it would make you, feel happier, it would improve your social relationships, you'd be like more physically, right? It improves your cardiovascular health, it would make you think more clearly, your concentration would be better. Like everybody would take it, right?
Mm-hmm.
But the thing is, like, what that is sleep, and it is something like modifiable and changeable. It's just a little bit harder sometimes to prioritize or work on. So I think it has a big role in terms of quality of health. We know there's this like bidirectional relationship with, psychological symptoms, anything like from depression to anxiety to like trauma symptoms. We know it can influence your cognitive functioning, and that's, there's both like the short-term effects and then the long-term effects. Like we know later in life that, poor sleep quality and quantity throughout your lifetime confers much higher risk of of eventually getting dementia. So there's like both, how it affects you in the moment, but then also these like long-term health consequences in terms of like cardiovascular risk factors, dementia. So basically in all of the ways.
It's really interesting just because you really don't think how much sleep actually affects every part of a person's life, and you bring it back into the athletic part of it. It's just no one really sees how much sleep actually affects someone's day-to-day life in general.
Well, yeah, and I think from the sports perspective, there's definitely been a lot more initiatives from like the NCAA trying to, I think, find a way to pitch this in a way that actually motivates change. So trying to focus on the fact that, right, it improves your athletic performance, right? It can make you, right, like quicker. Your reaction time, makes you a better like athlete. You can recover from injury quicker. You can recover from like an intense practice where, right, if you have better sleep. So kind of like trying to pitch it from the performance, perspective as a way to like motivate, right, change, especially like college student athletes have a lot on their plates, right, that influence their sleep. And so it can be hard to prioritize it. So I know there's been some initiatives on the NCAA's part, at least, to try and frame it that way.
For sure. I know being an NCAA athlete myself when I was an undergrad, it was definitely hard to get sleep, and hearing like my athletic trainers kind of preach how much sleep wasn't, like how important sleep was. It was going to the performance aspect of it, hearing that, knowing that sleep does affect my performance. I was able to kind of look at it like in their eyes as athletic trainers and see, that it is something that is affecting me, and how I could see the different days. Like, I didn't get good sleep one day, practice wasn't as good that next morning, and then vice versa. So yeah. So one of the articles that I read of yours, I know we emailed about it a little bit, was the prospective implications of insufficient sleep in athletes. This study examined the effects of the insufficient sleep in collegiate student athletes at baseline concussion testing, as well as factors like symptom reporting and neurocognitive performance at baseline associated with insufficient sleep for the risk of sport-related concussion. One thing that stuck out to me while I was reading your article was that insufficient sleepers at baseline reported a higher number of baseline symptoms compared to people or compared to patients with sufficient sleep. Would you be able to expand on that and why you think that was?
Yeah, sure. So when you're talking about symptom reporting, when it comes to concussion, these symptoms are non-specific to concussion and very heterogeneous. So it includes things like, headache, dizziness, trouble concentrating, fatigue, drowsy, anxious. These are just some of the symptoms. Now, normally, right, if you just pull a room of people, right, say walk into a college classroom, most people aren't going to say they have zero of those things, right? Like on a typical day. But imagine how you feel the morning after getting a night of poor sleep, right? Some of those things are probably going to be increased. Yeah, you might have a headache. It might be a little bit more difficult to concentrate in class. So I think it makes a lot of sense why sleep would, right? It's it's not that you have a concussion and that's why you're reporting those symptoms. It could be that you didn't get a good night's sleep. And so you're reporting more of these symptoms that we assess, right? It's part of, right, the concussion diagnosis and management is asking people about these symptoms. But again, when you're asking people at baseline, number one, people will report those symptoms, and then there's some factors that can make that more likely. So some of those non-specific to concussion things that influence symptom reporting, right? And so I think if anybody reflects on how did I feel after I didn't get a night of good sleep, or if I chronically have a sleep problem, makes a lot of sense why people would be saying they have some of those symptoms that we ask about.
Yeah. I know we you kind of touched on it before of hold on, sorry. The results from the study showed that the insufficient sleepers were nearly twice as likely to sustain a sports-related concussion compared to the sufficient sleepers. Was that kind of going back to what you just talked about and the higher baseline symptoms?
So I think the interesting thing is it's both it's the combination of, right, they have higher symptoms. What we also found is that, right, there were these kind of key comparison groups. There were all insufficient sleepers, right? So we had insufficient sleepers at baseline who either went on to get a concussion or who did not. And then we had all people who went on to get a concussion, so they could have had sufficient or insufficient sleep at baseline. And so we have these key comparison groups. And what we really see is for, all the insufficient sleepers, those who go on to get a concussion at baseline, right, performed worse on neurocognitive measures of attention and processing speed. And that for the sufficient sleepers who went on to get a concussion and the insufficient sleepers who went on to get a concussion, similar patterns, right, emerged where at baseline they were doing worse, right? It's the combination of insufficient sleep and poor attention and processing speed. Those are the insufficient sleepers who got to get a concussion. Right. And so I think it's the combination that could increase the risk of future concussion, right? It's obviously really important, if you're doing something like football, right? Where there's a lot of contact, if your attention and processing speed, right, if you're not paying attention or if you're moving slightly slower, maybe because you're not getting enough sleep, then that's going to, maybe you're going to play in a more dangerous style. You're not going to react as quickly. You might be more prone to get an injury. And we see that with other musculoskeletal injuries, right, in terms of lack of sleep and how it can kind of degrade performance and reaction time and those things. And then I think, right, the other symptoms that are being reported, those could be related to, right, that bidirectional relationship, say between mood and sleep, whatever it might be, that's just increasing the chances, right? If you're playing with a headache and, right, again, it's going to maybe take your attention away. whatever it might be. So it really just seems to be like the combination of those two factors, I think, that was important.
Yeah. So how, when a patient gets a sports-related concussion, how does it affect a player's performance after they've recovered, if there's any if there's any difference?
In terms of their sleep, like after, do you mean?
Yeah.
Well, I think it definitely gets a little bit trickier after concussion because the concussion itself can disrupt like the sleep system. So people who might not have any sleep problems beforehand might kind of in the acute period have disrupted sleep. So it then in and of itself can become a symptom of the concussion. So it gets a little bit complicated after a concussion. But right, it could be part of like the normal recovery process. Like we expect it to get back your sleep to get back to normal. Of course, like if you have like a pre-existing, formal sleep disorder like insomnia, sleep apnea, whatever it might be, right, it's not like that's going to go away after the concussion or anything. But it's an important point of probably like intervention.
And how would, say someone does have something like insomnia or sleep apnea, how would something like that affect like recovery from a sports-related concussion, or even like post concussion?
hmm I mean, I think in all the ways that those, if you remove the concussion piece itself, in all the ways that those would be important things to get treated anyway, right? Because they, confer risk for like cardiovascular disease, and right, all of the things we talked about with sleep earlier, like poor, quality of life, increased mood problems, maybe, impairs your attention or your, whatever it might be. And then I think that could be exacerbated, right, in the acute period. So you've got, you don't just have one thing, you have, right, the sleep problems. If you already had them, the concussion happens, probably see a rise, right, in the effect of that, at least temporarily.
Mhm.
And right, can those types of things that can exacerbate those symptoms might lead to somebody having like persistent symptoms after concussion, right? Could potentially prolong their recovery. It just makes it a little bit more complicated, which is why it could be right important to identify and have that be part of the concussion management, like from the get-go, instead of waiting for, right? Because I think what we're starting to understand is those people who do experience those persistent symptoms post-concussion, it's oftentimes related to like a secondary factor, maybe that hasn't been addressed. In this case, sleep, but it could be others as well.
Yeah. As athletic trainers, concussion screening, like baseline testing, is a big part of what we do. And you've had your fair share of doing that. What would be things to look for when we are screening, and what are some things that we have talked to our patients about when it comes to getting sleep and its relationship to sport-related concussions?
Yeah, I mean, I think, more often than not, there's going to be some sort of symptom checklist that's part of that. Whatever symptom checklist that you use, right? There's been a lot of research kind of parsing these out into different like symptom clusters, or symptom patterns. So you could quickly look like on the ones that are related to sleep. How is somebody reporting these? Are they kind of standing out as, this person's saying, if it's on a 0 to 6 scale, they're reporting 3s and 4s for the sleep related ones, and not much else for other areas. That could be worth having a conversation, a more in-depth conversation about their sleep quality, quantity, their sleep hygiene, if there is a sleep disorder or something like that. So that could be something to like keep an eye on. I think what sometimes can be challenging is having been part of massive baselining efforts at the beginning of the season is, right, these could be like freshman athletes arriving to campus like 2 days before. It's like the first time they're away from home. Maybe they're trying to get to know their teammates well, right? They're like bonding. They're often like, say, not getting a lot of sleep before they come in for that baseline assessment. So you're both like capturing maybe like an idiosyncratic, like this person maybe is stressed that they have moved away from home for the first time, and now they're right. It's like 2 days after they arrive on a college campus. So I think that's also important to be aware of. Is this indicative of a larger pattern that would be worthy of like intervening, or right, are you not getting actually a good assessment of baseline, right? Like I think that's the big part, is understanding is sleep influencing the baseline performance so much that it's not going to be a valid or good comparison post-concussion, right? Because the thing is, you're going to repeat what you did at baseline after a concussion, and then you're going to look and you're going to say, is this person back to where they were? Well, if they were reporting like 20 symptoms at baseline because they only got 2 hours of sleep the night before and they were stressed out and homesick, and then you're looking at it after a concussion and maybe they have 15 symptoms, and you're like, it's even less than at baseline, but they're saying they have like maybe these are actually more related to concussion, whereas the other ones were related to poor sleep. And so I think you have to be aware of whether or not you're getting a valid baseline assessment, because it's only useful as that post-concussion comparison if you can have confidence in the fact that it's a valid baseline. Otherwise, it might be worth repeating it, doing it at a time that they have had more typical, a typical night's sleep or something like that.
Yeah. When would be some situations, or like how would you go about talking to patients who may have, like you said, who may be homesick, and you don't want to cause them extra stress, and talk to them about their sleep, but don't want to cause them that extra stress that they may be getting from being homesick and moving away for the first time?
I mean, I think a couple things. One could be just kind of like really normalizing that experience, right? Like, yeah, it's not uncommon for us to see, right? When people get here, there's a lot of adjustments. You're living in a different place. Maybe you're getting used to roommates. You want to, get to know your teammates. Maybe you're stressed out academically, right? These are all really big adjustments and would understandably affect anybody's sleep. But right, since it's like early on, right, and we know that it's important for academic success. It's important for athletic performance. It's important for quality of life. Just something that we wanted to kind of keep. So kind of normalizing, like it, not kind of like pointing them out as like you're kind of the abnormal person here who's not getting good sleep. And then some of the things we were talking about earlier, like how are you going to frame it? Like what's going to be the most kind of effective, kind of motivating tool? Is it the reason we're bringing this up is because it's important for your athletic performance. We're interested in kind of the whole athlete here, right? Like we want to make sure you're good from like a physical, mental health perspective, right? When you're out on the playing field. And so, I guess it could depend on the culture of the school or the team or the philosophy of the coach, like how much emphasis they put on those things. But there are a couple of different ways to bring it up.
Yeah. Would you go about it in a way that like geared more towards physical, like keeping their physical performance up, or would that kind of just be like a depends on the team, depends on a person basis, that kind of thing?
Yeah, I mean, I think that's where like the clinical skill comes in, right? Like for athletic trainers, right, you get to know these people pretty well, right, when you're working with the athletes. So you probably have a good idea of, what might be like, what are the important values to the person that you're maybe talking to about this. It's just kind of like meeting them where they are, right? Because, right, like I was saying earlier, I don't think it's that people don't know this, right? It's not like, it's just hard to implement. And I think, right, like recognizing that too, like when you're a student athlete and you have lots of hours of practice, you're traveling for competitions, and you also have like a huge academic load to keep up with, right? The first thing you're going to you're going to stay up late to finish assignments, right? If you need to. And it's just like very hard, I think, to convince people otherwise, understandably. So I think also understanding like the realities that, right, that somebody might be dealing with in terms of like time management. And maybe that's kind of the road in is like, are you really having a hard time with time management? Because that's another, right, that's something you can work on. You could, from like an academic kind of coaching, or you kind of work with whether it's advisors or something like that to kind of improve that if that's really what's interfering with sleep. There's a number of things that could, though.
Yeah. I know you have some experience working in the NHL as a player health management assistant. Would you be able to talk a little bit about your experiences in this role, what you were involved in, like more so like along with the like data analysis and the research aspect of it, and what you're looking for in the data?
Yeah, so there's a couple of aspects of what I do, but right, there's a concussion protocol, right, in the NHL that they follow for, the identification and then management of concussions. And right, the big goal of, the league and, the team that I'm a part of is they want to be as good as possible at detecting and then right managing concussion. So the sooner that you can identify concussion, right, the sooner you can treat it, the better. So rather than having players, continue to play in games or, go a week and then say, hey, I hit my head. And so really the what they're looking for in the data is various ways to improve the accuracy of detecting concussion. And they do that like a number of ways. They have, the way their protocol is set up, there's on ice, people who are looking out for, specific visible signs and symptoms of concussion, certain types of events that require mandatory evaluation. Or video review. And so, at any time we might have like various projects that are aimed at, are there signs and symptoms that we could add to that, protocol to improve the diagnosis. And then there's like the management piece. So each of the teams has a main and then the backup consulting neuropsychologist who might, see athletes at baseline or post-concussion to do this type of testing that we're talking about. And so that's kind of like the second piece is just kind of the like day-to-day like administrative like kind of being a contact person for the consulting neuropsychologists who are like the boots on the ground with the actual evaluations.
What are those like some of those testing that those like on-site neuropsychologists doing, if you're able to kind of talk about that?
Yeah, I mean, so it's similar. I mean, basically in all of the settings I've been in, from early on with like the CARE study at Princeton, the concussion management program at Penn State, any like clinical evaluations of concussion, it's usually been the same. So, there's going to be you're going to be getting symptoms, you're going to be getting clinical history, especially if it's after a concussion, right? Like, what happened afterwards? Have you been feeling those types of things? So just your general clinical interview. And then there's popular computerized neurocognitive testing. So like one of the most popular is the impact test. It's like a 30-minute test. So we often do that because we have baseline data usually on that, right? A lot of these at the college level, the professional level, whatever it might be, there's policies in place about baseline testing. And then additional like paper and pencil like traditional neuropsychological tests that would be part of, if somebody is coming in for any type of referral question. But the ones that tend to be part of a concussion series of tests would be ones that focus more on the areas known to be, particularly impacted in the acute phase after concussion. And so, the balance is wanting to get a lot of information, but also, not wanting this to be a 6-hour evaluation. So it's usually like an hour and a half, when all is said and done, like post-concussion for those.
Yeah. The NHL is something that I love, and I found that you're like looking kind of over and doing a little bit of research on you. I thought that was something that was really interesting. So thank you for sharing that.
Yeah, of course.
The last thing I got is the biggest takeaway from this episode that you think could be put into practice more.
Well, yeah, I mean, I think for me, and this is, the paper that you're asking about, but, I kind of have a series of papers related to sleep and concussion. And the whole point is that this is something that you can change, right? Like I can't unhit you in the head if you have a history of multiple concussions. If you have a history of something like ADHD, or like there's if you have, certain genetic risk factors, right? Like some of the things that we know maybe increase risk for concussion are completely unchangeable, right? Cannot do anything about that. Some of them actually are, right? So if we know that like poor sleep is going to increase your chances of getting a concussion or increase your chances of having persistent symptoms after concussion, right? We should be trying to kind of intervene at that earliest point, right? Like not waiting for the injury to happen, but trying to prevent it in the first place. And I think the key to that is these modifiable factors, right? Points of intervention like that, as clinical neuropsychologists, clinical psychologists, like we're trained at evidence-based interventions in these areas. So it just seems like kind of a no-brainer to me to focus on those. And right, kind of framing it that way too, right? Like you don't want to get injured and you don't want to be out any longer than you need to. So that could be also why this is important to focus on.
Thank you, Dr. Riegler, for being a part of this podcast episode and your expertise in this topic. I've really enjoyed talking with you and learning from your experiences and reading a bunch of your articles. Yeah, thank you. I appreciated talking with you.
Yeah, thanks for having me.
Of course.